We start with the court, or this could be two lawyers discussing the fact that their clients have very different views about where the problems are coming from. And they want to ask someone to give them information about what's going on in the family and what's causing the child's resistance to one parent. Or it could be that you do start in court with a temporary orders hearing, and there are problems that are beginning to surface, and the court says, I need a deeper investigation of this. So at this point, whether it's lawyers or the court, someone is appointed. I call this person a treatment team lead because statutes vary from state to state in terms of who this person or what this person would actually be called. In my state, it's going to most likely be a guardian ad litem. Many guardians here in Texas are mental health professionals who have backgrounds working with high conflict families, and so they are the natural choice for this role. After the treatment team is appointed, there is probably a in-depth assessment done, especially whenever this person is appointed early in the process, either by the lawyers or the court. However, if it's the case that there has already been a full evidentiary hearing and the court has made a finding of alienation, and they've also implemented a no contact order, and they want a therapeutic intervention to be for the family to undergo that, they may at that point, after the finding of alienation, appoint this person. I've also done that in the role of a case manager or in the role of a guardian. And in that instance, there's not an assessment that needs to be done because the court has already made the finding, but there is an intervention that needs to be set up. And so the team lead would choose a family therapist that they know has the specialized knowledge to work with the targeted parent and the child or the children. They would choose then a different therapist to work with the alienating parent. The hope is eventually that the alienating parent can gain enough knowledge about their own contributions to the problem that they could begin doing family therapy with the targeted parent and the children. But initially, they have a certain amount of education and self-awareness that needs to occur before they're ready to work with the family therapist. If there was the need for a psych evaluation in order to inform that therapy with the alienating parent, the team lead could recommend someone to do the psych evaluation if the court has not already ordered that. So when there are red flags about personality disorders or a delusional disorder, there may need to be a psych evaluation done first before the therapy with the alienating parent can really address what's going on at a deeper level. The team lead may decide to appoint some other therapist in the process. So again, this is this idea of flexibility where you work, you get the family doing a certain amount of work. You may gain information that you need some other help also. I like to start with just a family therapist and then a therapist for the alienating parent because the smaller team is easier to manage and easier to keep united. But I don't ever hesitate to appoint an individual therapist for a child or a parenting coach for the targeted parent who seems to be struggling with regaining their parental authority and working at home with the child.